Welcome everyone to my channel Health and Fitness. Today we are going to talk about aerobic exercises. Aerobic or with oxygen exercises provide cardiovascular conditioning. The American Heart Association recommends a minimum of 30 minutes of cardiovascular exercises 5 to 7 days per week. Don't forget to warm up, cool down and stretching exercises in your aerobic exercise sessions. So what is aerobic exercise? Aerobic exercise provide cardiovascular conditioning. The term aerobic means actually with oxygen, which means that breathing control the amount of oxygen that can make it to the muscles to help them burn, feel and move. Benefits of aerobic exercise. Number 1 is improve cardiovascular condition, decrease risk of heart diseases, lower blood pressure, increase HDL or good cholesterol, help to better conditioning of blood sugar, assist in weight management and or weight loss, improve lung functions, decrease resisting heart rate. Exercise safety. It is recommended that you talk with your physician before you start aerobic exercises and ask what if any limitation you may have. People who suffer from diabetes, hypertension, heart diseases, arthritic, pulmonary condition or other health condition may need additional safety guidelines for exercises. Note: if you develop systems using during exercises including but not limit to unusual shortness of breath, tightening in the chest or shoulder, jaw pain, lightheadedness, dizziness, confusion or joint pain, you should stop exercise immediately and contact your physician. So what are the examples of aerobic exercises? Lower impact aerobic exercises include swimming, cycling, using an elliptical trainer, walking, rowing, using an upper body aerometer, a piece of equipment that provide a cardiovascular workout that target the upper body only. High impact aerobic exercises include running, jumping ropes, performing high impact routine or step aerobics. How often and for how long should I do exercises? The American Heart Association recommend that everyone reach a minimum of 30 minutes of some form of cardiovascular exercise 5 to 7 days per week. This can be broken down into 10 minutes of the time period. This means that taking 3 walks for 10 minutes and you would reach the recommended minimum guideline for reducing the heart or risk diseases, diabetes, hypertension and high cholesterol. You may also burn the same amount of number of calories as you would if you walked for the full 30 minutes or 1 minute at a time. The American College of Sports Medical recommended a minimum of 3 sessions of 30 minutes. Of the total should be made up of a moderate to vigorous exercises to improve cardio, respiratory fitness and help manage weight. It is appropriate to do aerobic exercise every day. There is no need to rest in between sessions unless you are at the extreme level of training, such as preparing for a marathon, or if you are experiencing recurring joint pain. If joint pain is the limiting factor, it would be appropriate to alternate less pain exercises with those that may cause joint pain or discontinues the pain exercise altogether. Explanation of intensity is that the intensity is determined by how long and you are working hard. The intensity of the exercise is determined by what your goals and what limitation you have, your current fitness level. Heart rate and exercises. Your heart rate increase in direct correction with the intensity of the exercises. Heart rate levels vary significantly from one person to another based on the fitness level, genetic environment, exercise tolerance. If you wish to train based on heart rate, contact your heart specialist and determine what are the appropriate range for you. Some meditation may often provide blood sugar, drug control and high rate, making it possible to determine exercise intensity in this way. Ask your physician to determine if you are on the way of these medications or not. So what are the monitoring of intensity in other ways? How can you know if you are working at the right intensity? Using a RPE chart can help you determine the appropriate intensity. The scale uses a 1 to 10 rating system. On it is very light, such as walking to the refrigerator for a glass of milk. 10 would be a signal level representing a maximum exercise. 10 would be an indication of not being able to walk another steps without fear of collapse. If it is not recommended for anyone to walk at the rate of 10 without strict supervision by a healthcare provider. Moderate intensity is the level of exercise that is most recommended and can be determined by a rating between a 3 to a 5. Warming up and cooling down. Every session of aerobic exercise should include a warm up and a cool down. The warm up period should not include static stretchings but should indicate with a gradual increase in the pace and intensity of the exercise. This allows the body to increase blood flow to the muscle and decrease likelihood of a muscle or joint injury. The warm up should be between 5 and 10 minutes. The cool down session should be last as a similar amount of time as the warm up, with the pace gradually decreasing. Stretching exercise should be appropriate after aerobic exercises. Progression of the aerobic exercises. Progression to higher intensity of exercise should be based on individual exercise tolerance. There are 3 methods of challenging aerobic exercises. Number 1 is increase speed. Number 2 increase the distance. Number 3 increase the duration. Any of these methods or a combination of these methods will improve aerobic exercise. Increasing intensity should be done very gradually. You should challenge yourself for only a few minutes at a time.